On the new CDC guidance, it's getting some criticism that it's confusing, the testing after leaving isolation, because it says that you don't need to test after day 5, but if you can get a test, if you want to test, and you test positive, you should continue to isolate until day 10. So that would potentially create a gap of people who are positive after day 5 but don't test and go back out into the community. And then there have been other policies that have shifted, including the policy around healthcare workers needing to test negative before returning to work, and then that going away. And also the note in the new CDC guidance that negative tests don't necessarily mean that you're infection-free. So is the CDC still led by science and not by other factors in determining its policy?
Well, Jackie, the CDC is absolutely led by data and science. And, again, if they hadn't changed their recommendations over the course of time, schools would probably be closed across the country, right? They, of course, are continuing to address, as they have for the past year plus, steps that need to be taken in order to protect the American people. The CDC's guidance did not add a recommendation for testing, including in workplaces. The CDC director just answered this question on a COVID briefing about an hour ago, where she basically said there was a lot of questions about testing, and she wanted to provide information in response to that about how to apply a test should people decide to use a test. They have also conveyed in their guidance, and they can speak for themselves, of course, that transmission and infectiousness occurs in the first 5 days after diagnosis with COVID-19, somewhere in the range of 85 to 90% of the time. Hence their guidance on the 5 days. So they can speak to their own guidance. It is led by data and science. It is not determined here by the White House. It is determined by the data and the scientists who work at the CDC.
The CDC, Rochelle Walensky and Dr. Fauci, as we've talked about earlier this week, had conflicting accounts of whether testing was necessary. Dr. Walensky said part of that consideration was what people would tolerate. And we know that it's important to keep schools open, to keep the economy running. Isn't it time to incorporate some of those other messaging points into this administration's discussions about how we emerge from this pandemic? We talk about how it's led by the science and we're following the science, but it seems like we're also following economic needs and political needs and logistical needs.
Well, here's the difference from the last administration. We are not driving our decision making on how we're addressing the pandemic through messaging or through political concerns. We're driving it by what the CDC and the medical doctors and the experts there convey. They update their guidance, they change their guidance. Certainly, I'm sure they have disagreements internally about what guidance they should put out. That is a healthy part of a discussion of a policy process. But that's what we're driven by. And that's also why we do COVID briefings, so that you all can ask those questions, as you just did this morning an hour ago.